Hey everyone, welcome to week 2. You have now completed your first set of discussion boards, and so I kind of want to just take a moment to go over those and review them with you. So the first discussion board or activity we had you do was on the NAMI in Our Own Voices presentation. So it looks like a lot of the key takeaways that you guys got from that video, there was a lot of overlap that you guys took away, a lot of the same information, and a lot of stuff that we were hoping you would. So one of the things that I noticed a lot was about this mental illness or mental health disorders can be very difficult to understand and treat, both from the side of the healthcare professional as well as the patient. There is some difficulty with patients understanding exactly what's going on with them, and then there's also difficulty, understanding how these treatments might help them. But on the reverse side, the healthcare professionals might have a better understanding of these diagnoses and the treatment approaches that are necessary, but they might lack in communicating that information or educating the patient. So there can be a disconnect there where the patient feels very confused, alone, ignored, kind of dismissed. And so I thought those were really good points that you guys brought up. In addition, several people talked about that, these mental health disorders are often not obvious if somebody has one. You can't necessarily look at someone and say, that person has major depressive disorder, or that person is bipolar. So it's really, which then also makes it very difficult sometimes to understand and for other people to understand what somebody is going through when they are suffering from a mental health condition. So some interesting points and some things I want to say is that if you look at the DSM-5 criteria for these different mental health disorders, people will, in order to be diagnosed or classified or, as having this condition, they need to meet certain symptoms and severity of symptoms. However, there are people that might not meet the severity of those symptoms or not all of those symptoms, but it's still pretty debilitating to them. So kind of understanding where do you put those if they don't quite meet the DSM-5 criteria. Is it as simple as you either have it or you don't? No, not really. There's this whole gray area in there. And so how, the diagnoses in the DSM are a guideline, I think, for these mental health conditions because nobody fits perfectly into these kind of cookie cutter diagnoses. There's a lot of comorbidities and so forth. The other thing is that people could experience anxiety and depression, but be totally okay as far as like they're managing it and they've come up with some good coping strategies and it's not debilitating to them. It's not interfering with their ability to live a meaningful and full life or hold a job or anything. And so that's kind of a key criteria there is that the condition or the symptoms need to have a debilitating effect on that person's life, and they need to have a significant interference in their daily functioning and social interactions, ability to hold a job, work. And so sometimes it might not be obvious to the patient if they are, if these kinds of symptoms they're experiencing are interfering with their lives. So for instance, when somebody is having a manic episode, they might think everything feels great, they're happy, but they're spending all this money, they're engaging in risk-taking behavior that's like could put them and their lives at risk and their safety at risk. Other people might notice that. And then in return, there might be things that the patient or the person is feeling that is very debilitating and very interfering, and they feel that there is a problem, but maybe we don't see it on the outside. And so their concerns or whatever's happening with them is no less valid than something that we can actually see, right? So think about mental health conditions and illness as no different than any other sort of like medical condition, okay? Just because we can't necessarily see it doesn't mean it isn't there and it isn't causing distress. Another thing that I want to talk about is that you guys mentioned about this patient-centered approach, that how you would incorporate some of these key takeaways from the video in your own practice as a pharmacist is to make sure you're talking with the patient. They understand their medications, their treatments, you listen to them, you listen to their symptoms, what's bothering them, and so forth. So that is really good and really important, and that's the kind of care that we want you guys to provide as pharmacists. But my challenge to you is to actually implement that when you are a practicing pharmacist. It can be easy in kind of the hustle and bustle and the fast pace of our work that we kind of lose sight of that, or maybe overlook that, or, just hand off a medication. Okay, they don't say anything, they must be fine, let them go. So I'll tell you that, in over the past decade of picking up prescriptions from my local pharmacy, I have never once spoken to the pharmacist there. Not once has anyone ever asked me if I have questions about my medications or any concerns, or really has asked me anything other than, okay, last name, verify your address, here you go. And so I've never had questions, and it hasn't really bothered me personally, but I'm just surprised that I've never been asked before. And sometimes people don't know to ask or advocate for themselves. So just be mindful of that when you are practicing. And it doesn't matter if you're retail pharmacy or clinical or in a hospital setting. Okay. So you guys did a great job there. The second discussion board that I posted was about these supervised injection facilities. And it looks like there was a lot of really good arguments for and against, and a lot of people that were kind of like, this is tough. I don't really have a strong feeling one way or the other. Like, I can see the pros of it, I can see the cons of it. I don't really know if they're good or bad, right? And that kind of is the sentiment. I mean, there's some camps that are very against it, very for them. And then when you read both sides, I mean, they bring up both valid points. So it's tough. And so I saw a lot of kind of comments about, that supervised injection facilities might promote drug use. And so I wonder, okay, so does it really? All right, so let's think about this. When someone has a substance use disorder, let's say they're using heroin. When they first try heroin, okay, they try it, they get a high feelings, and then maybe they go through a little withdrawal once they come off the drug and come off that high, and they want to, or later on they're like, I want to take that again. That was kind of like, I liked that feeling. It starts to shift though. The drug use and the reason for taking the drug use can start to shift in addiction. And where that comes in is that it's not so much about feeling the high as much as it is about avoiding the withdrawal and the withdrawal symptoms. So when I think about these supervised injection facilities, I think, okay, is it going to be promoting drug use? Well, honestly, people with substance use disorder, part of the problem with addiction is even if they want to stop, they can't, because it is so painful to go through that withdrawal and try to get off of that vicious cycle of taking to avoid withdrawal, take it again to avoid withdrawal. It's hard to break that cycle. So even if they wanted to, it's difficult to. So chances are people are going to use, if they're going to use drugs, they're going to use drugs. So do we want them to go to a facility that is clean, that while they're using their drug, in case anything were to happen, there is a medical professional there to be able to help them and assist them in a medical emergency, provide care for them? Or would we feel comfortable with them just going and being in their home by themselves, using, overdosing, potentially dying, or going and, on the street and sharing a needle with people, potentially passing and acquiring different communicable diseases through that, so HIV or hepatitis or anything like that. So that's one kind of argument, so it could promote drug use, but really will it? People are going to probably use drugs if they're going to use drugs, and it doesn't really matter where, but can we give them somewhere safe? And a lot of you brought up that point. So one thing I want to also kind of pose in there is, what if you had a loved one that had a substance use disorder? Would you want them to have the ability to go to one of these places to be safe if they're going to use their drug? Or are you okay with them being in another type of situation without any medical oversight or anything? So I think sometimes when we think about the direct impact that can have on us, and some of you might have had similar experiences with this with loved ones, what would you like them to have? So let's give people the benefit of the doubt that if they're addicted to something, chances are it's because they're trying to avoid the withdrawal of that substance, and not so much because they don't care and they just want to use drugs. I'm not saying that's the case for everybody, but I'm just saying let's kind of maybe think in a different perspective here. Some of the other things that I thought were really interesting that you guys brought up were kind of potential legal ramifications, right? So if people are going to if it's known that these facilities exist, and we know where the facility is, and we know that people that are going there are going to use illegal substances, what is stopping the police from hanging out outside these places and busting people? So one thing I want to clarify is that the healthcare providers of these facilities don't actually supply the drugs, okay? The people that are coming there, the people using drugs, are coming there with their own drug. And so they've acquired it however they've acquired it, and they're just coming there and they're using it, and they're given access to clean needles and things like that. Things that they would otherwise access, but maybe not clean needles, dirty needles, whatnot. What are the legal ramifications of that? They could bust them even outside of the facility if they know they're going there to use drugs. What about potential legal ramifications for the healthcare providers? Even if they're not providing the drugs, but they're present when it's there, and they're, is there some sort of ethical or moral obligation to stop people from using? And does that then carry over into a legal issue? So it's a really tough one. There are both good pros and cons for it. One, you guys brought up a lot of good statistics. So a lot of these facilities exist internationally. And so Vancouver, there's been some studies on the impact of these supervised injection facilities. If you haven't read Crystal's post on this, she offers some really good data from that study in her post. A lot of you also cover that. She has pretty extensive for both for and against. So I would take a look at that if you haven't read it. But you guys did a great job. You did a great job responding to these questions. It's tricky. There is no, good answer necessarily in these. So just kind of thinking about everything in different perspectives. So this is something that is, really possible, and something, the clean needle programs. Those are all things that might seem counterintuitive, but maybe they do have a benefit that outweighs potential risks we might think they have. So, great job. The level of detail you've put in your posts and the thorough, kind of thoughtful responses you've given each other, please keep that up. That's exactly what I'm looking for. That's what gets you your full points. So make sure you keep that up throughout the semester. I really enjoyed reading your thoughts and ideas and the support you found for it. I was very impressed. So thank you. This week we've got a topic on burnout and diet and mental health. So the topic on burnout is going to be covered by PGY1 resident Dr. Caitlin Spessard. She has a video that that is uploaded in that module where she gives an overview on the burnout kind of topic for this week, as well as her activity. Her activity requires you to do some things over the course of several days and then kind of reflect on the things she asks you to do. So it's really important you take a look at that now and not wait until, Monday or Tuesday to get on that activity, because you will not have enough time to do it. And then the second topic is diet and mental health. And this is from Dr. Burkhart. He has put together another activity for you, which is pretty fun. And so if you've never really considered that your diet and the makeup of the foods you eat and so forth can have an impact on your mental health. So you'll do a pretty cool activity with that, analyzing how that impacts treatment decisions and a patient's symptoms. Also, at the bottom of the module, I've included 2 links to video walkthroughs of the activities from this past week that Dr. Burkhart had you do on the pharmacogenomics and depression as a side effect. So if you're interested in seeing kind of the answers from that, he's done like a video walkthrough that you can go ahead and take a look at. All right? If you have any questions, don't hesitate to email any of us. And otherwise, I wish you a happy, healthy, and wonderful week, and I will see you next Wednesday. Bye.